Hello and welcome to the Nurse Station. I'm Maria Mobley, and today we are going to learn about the ABCDE approach. And just a little background about why I wanted to teach this. I was just tutoring students preparing for the NCLEX, and we were doing a case study, and the answer was assess airway patency. And I said, yeah, absolutely. And I said, how would you do that? And they were like, oh, how would we do that? So I don't want y'all to just say airway. I want you to understand what it means to assess the airway. I want you to understand what it means to do airway interventions. I don't want you to just say breathing. I need you to understand how breathing assessment looks and how we intervene as nurses for breathing. So the ABCDE approach stands for airway, breathing, circulation, disability, and exposure. And we use this as a systematic approach for clinical emergencies. So if we have a critically ill client or a patient that's deteriorating, we're going to systematically use this assessment, starting with airway. First, you assess airway. If you find an airway problem, you intervene. So pretty much each step you assess. If you find a problem in that body system, you need to act right there. It's to sustain life. Now, let me also stress that this is not indicated for cardiac arrest. If somebody's in a cardiac arrest, you need to initiate CPR. This is for a client that does not meet CPR requirements, okay? So let's start with airway. How do you assess an airway on a patient? So if they're unresponsive, you're going to do head tilt chin lift, just like you learned in CPR. I put a big star for a patient that experienced trauma. If there's risk of spinal cord injury, we don't want to manipulate or move their cervical spine in that way with head tilt chin lift. We would actually use the jaw thrust method. Now, if they are responsive, right? Think about you going to somebody who is awake and just doing head tilt chin lift, right? We don't assess their airway that way. We need to look for red flag indicators. So if a patient all of a sudden cannot speak, or if a patient has very concerning noises such as stridor, or you hear this audible rattling in their airway when they take breaths, those are all very, very concerning signs. They could have a partially leading to a fully obstructed airway. That's our main concern. Is our patient's airway patent? Is it open? Can air from the outside environment, can oxygen come in, and can they expire CO2? That is our concern. So a partially obstructed airway is a concern. A fully obstructed airway, we need to act right now. So we're going to assess for these things, and let's talk about how we can act. If you open their airway and you see a lot of blood secretion, something obstructing their airway, you need to act, you need to suction. If an asthmatic client starts wheezing and they can't catch their breath and they have an accessory muscle use, you need to act. And we might have to, don't forget positioning. I didn't put positioning here, but you need to put them in an optimal position, and you might have to administer inhaled medications. If you, for instance, give moderate sedation, and all of a sudden the patient starts snoring and starts desatting, and you realize that the tongue is flopped to the back of the mouth and it's obstructing their airway, you need to act. You need to reposition them. You can manipulate their airway using jaw thrust or turning them on their side. We need to get that airway back patent. If we can't, you might have to use an artificial airway. We have things that nurses can insert. One you need to look up is called nasopharyngeal airway. The other is an oropharyngeal airway. This is only acceptable for unresponsive patients, right? We wouldn't put it in a responsive patient, but oropharyngeal, it can initiate the gag reflex. But these are things we can do. These are actions we can take. We might have to perform Heimlich or back thrust for a choking patient. And eventually, if we can't maintain the patency of the airway, we might have to assist the provider to intubate for them to place the endotracheal tube. If they can't intubate, they might have to do a tracheostomy. We can assist with those things. We need to ensure, if we assess and identify there's an airway problem, that we are acting to preserve and maintain a patent airway. Now let's move on to breathing. And let me just stress, this is just a quick, I wanted to ensure, especially nursing students, if this is what you're seeing for the first time, we can't just think, Oh, airway, breathing, circulation. You need to know the meaning of it. This is just quick examples of how to assess and quick examples of how to intervene. We do have more. I'm just trying to give you a foundation. With breathing, when you assess breathing, you have to look at respirations. Do they have even chest rise and fall? Is it paradoxical? Is it uneven? Is one side of the chest not rising? What about how does their chest, their breath sound? Do they have crackles? Does it sound like fluid buildup? Do they have wheezes? Do they have adventitious breath sounds? We already kind of talked about chest movement. What about accessory muscle use? If they are using accessory muscles, that means the body is coping. The body is trying to help them breathe with muscles that we typically don't breathe with. Pulse oximetry, ABG analysis, all these things can show us breathing. I didn't put percussion, but percussing a chest can tell you, is it dull? Or is there potentially fluid in places that it shouldn't be? So if we identify a breathing problem, of course, place oxygen on them. One of the biggest things we need to do for a critically ill client, for somebody that is deteriorating, we need to give them oxygen. We need to administer it quickly. Bag mask ventilation. If they can't breathe effectively on their own, we can help them breathe. Remember, I'm sure in CPR, I know you had to learn ambu bags, giving rescue breaths. We have the capability of doing those things. We have the capability of teaching clients breathing techniques, pursed lip breathing, inspiration, expiration, deep breathing exercises, coughing and splinting if they have an abdominal incision to try to get secretions up and out to make sure that they're not sitting or obstructing the airway. Incentive spirometer use that helps improve respiration, right? And lung inflation. Let's talk about circulation. Quick ways to assess circulation. Auscultation of the heart. Do you hear murmurs? Do you hear sounds that are not your normal lub-dub? Bum, 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 bum. What about heart rate and blood pressure? EKG monitoring. Palpate pulses. Are pulses weak and thready? Are they full and bounding? Capillary refill, right? When we apply pressure to the nail bed, we should see a return of perfusion. We should see it refill in traditionally less than 3 seconds for the adult client. If it has a very delayed refill, and if it takes 5 seconds, 6 seconds, that could be a sign of delayed or a lack of perfusion to that area. Skin tells you a lot. Is it cool, moist, and clammy? Is it mottled? Is it warm and flush? These are a lot of things that can show you what's going on circulatory wise. Their urinary output, is it low? Is the body trying to cope and hold on to the urine and fluid in the body? So if you identify a circulatory problem, things we can do, we can get IV access. If you see or visualize active bleeding, apply pressure, stop the bleeding. Positioning, if their blood pressure is very low, heart rate is really high, if they're experiencing shock or decreased perfusion, wouldn't we want to place them in shock position? Their head of the bed flat with the feet elevated to try to get the blood from our periphery to go back to our core, our vital organs. What about medications we can administer, right? If they have chest pain, I know the acronym, evidence has changed a lot with chest pain and how we act, but MONA is something you will always learn in nursing school. Chest pain, morphine, oxygen, nitro, aspirin administration. What about if they're in shock, vasopressor administration, fluid and blood product administration as needed? Let's look to our disability. Disability. So we are thinking, how is their presentation? Are they alert? Are they oriented? Are they responsive? So for disability, we use a very quick, abbreviated kind of neurological assessment, ABPU. Of course, we can use the Glasgow Coma Scale that I know you all have learned, but ABPU is the patient alert, standing for A. Is the patient only responsive to voice, standing for B? Is the patient only responsive to pain, standing for P? Or is the patient unresponsive? That's a quick acronym we can use to assess their orientation. What about limb movement? Can they move their limbs? Pupil responses. When we shine a light in a pupil, we should see a response, right? We should see constriction, not only in the pupil you shine the light, but in the other pupil as well. We like brisk pupil responses. What if it's sluggish? What if it's fixed? What if it's dilated? That can show you that something neurologically is going on. And of course, blood glucose. We know, especially low blood glucose levels can affect orientation as well as high. So these are all things we can assess quickly to identify and determine, is there a change in behavior? Is there a decreased level of consciousness? Is there something neurologically going on? These are actions we can take. We always, just a reminder, correct airway, breathing, and circulatory problems first. You can maintain safety. If they have a change in behavior, you have to keep them safe. Prevent them from getting out of bed. Combative, violent patients, that might be a response to hypoxia, abnormal electrolytes, things like that. We got to keep them safe. Give glucose for low blood sugars. Drug antagonists for needed. Changes in responsiveness can be due to overdoses. So we might have to administer naloxone, aka Narcan, but always know your generic names, to reverse opioids. What about, we have benzodiazepine reversals. We have ways or drugs that can soak up toxins in our body that we might have to administer for patients that might have exposure to toxins or drugs or substances. And then recovery position if indicated. I've already talked about an unresponsive patient. If they have a change in behavior, if they're unresponsive, if their airway is not protected, as long as it's not contraindicated, we need to be turning them on the side to protect their airway, okay? Now, exposure. Exposure, you need to quickly remove all clothing, maintaining the dignity of your client, because we need to look at skin. You need to look for abnormal rashes, wounds. You need to look, what if they have tubes and drains? We need to verify, are they putting out abnormal amounts? Is the drainage changing color? We need to assess body temperature. Could they potentially be hypothermic? Could they be experiencing a fever? So completely expose the body to look for any problems that you might identify with skin, wounds, bleeding, tubes, drains, temperature. And then ways we can act. I already talked about removing the clothing, absolutely maintain their body temperature. If they're hypothermic, warm blankets. We have things called bear huggers, ways to warm them back up. If they have a high fever, we have medications to bring that down. And any injury that you see or assess when exposing the body and maintaining dignity, you can treat. So that was just a quick example. This is how you assess airway. This is how you assess breathing. This is how you assess circulation and potential nursing interventions that you can do for those body systems. So as always, I hope this helps. And I just want to say, this is not just universal to your nursing practice. This is universal to when you're answering those questions. Again, if you identify a breathing problem in the stem, in the topic of your question, please intervene for breathing. Don't go assess their airway. You've already identified a breathing problem. If you identify a circulatory problem, or if the problem's trying to show you circulation, but you can't quite prove it, don't go assess their airway. Figure out more information about the circulatory tract, right? We want to always identify the correct topic, and this systematic assessment shows us and tells you if you identify a problem in that body system, you need to fix that first before going on to the next one. But if you assess the airway and it's patent, move to breathing. If you assess breathing and it's no abnormalities, they're doing fine, move to circulation. If you assess circulation, you find a problem, you stop and you fix it with a circulation intervention. I hope this helps. I love teaching you guys. And as always, if this helped you, please help somebody else so we can all be successful together. Take care.